seeking medical services under the new Social Health Insurance Fund will have to first seek treatment from a level 2 or 3 facility unless it is an emergency situation. Treatment from level 4, 5 and 6 and which will only be accessed through a referral from a primary health facility. Here now is the health insurance scheme as has been broken down into 3 different categories. Now, first and foremost, remember this is among the matters that have been of public concern. First and foremost, we have the Primary Health Care Fund. Then we have the Social Health Insurance Fund, SHIF, which has been one of the most spoken about. Then we have the Emergency, Chronic and Critical Illness Fund, which is the 3rd category in the Social Insurance Fund. Now, the next thing is the Primary Health Care Fund. To just break it down, first, every person who is resident in Kenya shall access healthcare services, and one must be registered under the SHIF to get services. Access to level 2 or 3 healthcare facilities is also one of the things that you'll be entitled to under the Primary Health Care Fund. Now, let's move to the next thing, which is the Primary Health Care Fund. Services include 1, promotive services, preventive, curative, rehabilitative, palliative care, and referral services. These are what are available under the Primary Health Care Fund. Now, the next thing is the Social Health Insurance Fund, SHIF. Now, under this, we have there'll be access on referral from primary healthcare facilities, that's level 2 or 3. Then we have services provided by level 4, 5, and 6 health facilities, and mandatory registration is part of what is expected of you under the Social Health Insurance Fund. Now, number 2, still under SHIF, each beneficiary will acquire a social health insurance number. Then the contributor may list beneficiaries in the application form, and persons registered under SHIF shall be required to register afresh. So this is still under SHIF. Now, number 2, still on SHIF, newborns are to be registered within 14 days. Then the child's biometrics shall be collected at the age of 7 years, and statutory deduction at the rate of 2.7% of the gross salary or household income is also one of the factors to bear in mind when you speak about the Social Health Insurance Fund. Now, aside from that, we have minimum contributions of 300 shillings per month, and this is for those especially who are not under payslip category. A person shall be treated as a household upon attaining 25 years, and a beneficiary shall be deregistered upon death. That is SHIF. And then we have the Emergency, Chronic and Critical Illness Fund, that's ECCIF. And this is the provision of emergency services and critical care, something that you're entitled to under that. Then we have treatment of chronic and critical illnesses. Then it is offered to all beneficiaries of SHIF, that's the Social Health Insurance Fund. And beneficiaries suffering from a chronic ailment shall transition to this fund upon depletion of the SHIF, and that is the Emergency, Chronic and Critical Illness Fund, ECCIF.